This video is to demonstrate how to give a subcutaneous heparin injection, drawing medication from an ampule. So the first thing that you're going to want to do is remember your 6 rights of medication. Make sure you have the right patient, the right medication, the right dose, the right route, the right time, and the right documentation when you are finished. For this heparin injection, we have gotten an order from the doctor to give Mrs. Hen a heparin injection subcutaneously. We're going to draw up 0.3 milliliters of heparin to administer to her today per the doctor's order. So first we're going to do hand hygiene, and then we're going to go to the medication room and we're going to find our ampule of heparin. Okay, so we're going to check over the ampule, make sure that it's intact, looks good. You want to either tap the top or snap the wrist to get all of the medication out of the top of the ampule. Okay, then we're going to make sure that we have a syringe, and when using an ampule you want to drop the medication using a filter syringe. So I'm going to attach that to my syringe. With heparin you can use a 1 milliliter syringe in the dosing. With the ampule, you are going to, using an unopened alcohol prep pad, or you could use a cotton pad too. You're going to wrap it around the top and then break away from you the top off the ampule. Okay, so we got that. Okay, and then we are going to draw up our medication. Okay. So draw up. You can invert the ampule, or you can just draw it up from the surface. Okay. Now the interesting thing with heparin is that you want to draw up 0.2 milliliters of air before you draw up your medication. So this creates a seal of air to keep the medication in place. So I did that. I drew up my medication. I'm going to double check that I have the right amount. Okay, 0.3, but with the air it's going to be 0.5. Okay, then I'm going to remove the filter straw and attach my 27 gauge needle. Okay, then I am going to go to the patient's room. Hello, Mrs. Hen. How are you today? I have an order from your doctor to give you some heparin. Would you please state your name and date of birth? So I'm going to check the name and date of birth with the wristband on her arm. I'll perform hand hygiene and put on clean gloves. We want to make sure that we have the right patient. Once that has been done, I will explain to Mrs. Hen the reason for her medication, which is the doctor's order for heparin, and that I'm going to give her the injection subcutaneously, In this case, we're going to do it in the abdomen. So, Mrs. Hen, I'm going to give you a shot in your abdomen. It just goes into the subcutaneous layer. So, it's not a big needle or anything, and it should not be a painful procedure at all. I'm going to take my alcohol and wipe from the inside out, making a circle on the abdomen. Of course, with subcutaneous injections, you do have some other sites you can use, but for this demonstration, we are using the abdomen. Once the site is clean and the alcohol has dried, I'm going to uncap my needle, pinch the skin and fatty tissue up in the abdomen there. And this injection, we are going to go down at a 90-degree angle, little poke right into the skin. I'm going to stabilize the syringe with my non-dominant hand, slowly pushing in the plunger until all of the medication and the air has been injected. I will remove my needle and syringe and put it right away into my sharps container. If there were to be any little bit of bleeding, I would gently blot the area with a gauze pad. You don't want to rub or massage the area, just gentle patting to get that put away. Make sure the patient is comfortable and answer any questions that she may have. And take off my gloves. Excuse me. And then I will go to the MAR and document the heparin was given, the amount of drug, so the 0.3 milliliters, and then also the site of the injection and the route. I will also put that information in my nursing notes, and that is how you give a subcutaneous heparin injection.